Okay, hello. On behalf of the EMHC, thank you for addressing this important issue and inviting us to participate. To provide context for my remarks, in addition to my role with the EMHC, I'm also co-chair of Alberta's Sexually Transmitted and Bloodborne Infection Strategy and a national director with the Community-Based Research Centre. I must admit to the committee that I never really planned to do this type of work. At 4, I wanted to be a paleontologist, and then at 12, I'm pretty sure I just wanted to be Shania Twain. I believe that I could be anything. But at the age of 23, when I was diagnosed with HIV, those possibilities no longer seemed endless. I'll never know for certain if I'd be HIV positive if I wasn't gay, but I do know that as a gay man, that I was 131 times more likely to be infected than my straight counterparts. As long as Canada has been a country, its queer people have had to start from several steps behind the rest, whereas others have had the opportunity to thrive, so often we've had to fight to simply stay alive. Inspired by early HIV activism, the EMHC was founded in response to the extreme health disparities facing our community and the lack of an effective response from the institutions tasked with our well-being. In just 3 years, the EMHC has grown from an informal gathering of community members in a living room over a case of cheap beer because we had no money, to a robust organization with a budget of $250,000, staff, and a variety of innovative strategies which address the unique needs of our community. This despite the fact that up until a few months ago, all of our work was 100% volunteer-powered, with many of our efforts requiring us to circumvent the health system instead of being supported by it. As I look back on the early figures who inspired our work, I think that perhaps they too did not plan to do this work, but instead selflessly answered the call to serve those that they loved, their communities, and their country. The impact of their service is apparent throughout every part of Canadian society, not least in the lives that they saved, including the nearly 70,000 people living with HIV in this country who will live and not die because of their contributions, of which I am one. Sorry. Today, this committee has the opportunity to honor that legacy, to ensure that someone's sexual orientation or gender identity doesn't require them to start life at a disadvantage, compromise their health, or limit their possibilities. This study is not business as usual. It's the righting of an injustice which has robbed us of countless lives and reduced the quality of so many others. While we agree with many recommendations before this committee, we recognize the challenge of trying to address every issue which has been raised. So we will reinforce 4 that we believe could have significant structural and sustained impact. 1, though there are many ways in which the quality of life is reduced for queer people in this country, for some these issues are particularly urgent. This is especially so for trans and gender diverse Canadians, many of whom experience significant barriers to gender-affirming care such as hormone therapy or gender-affirming surgeries. Care that will not simply improve their lives, but in some cases save them. We urge the committee to take comprehensive action, working with all levels of government to ensure that trans people across Canada have equitable access to gender-affirming care, regardless of where they reside or their financial means. 2, while we acknowledge the government's current investment in queer health, detailed in several submitted briefs, one glance at the extreme disparities shared with the committee show us that both in terms of scale and application, the current investment is insufficient. We recommend the establishment of queer-specific funding streams within any department which addresses issues which disproportionately impact the health of queer communities. Recommendation 3. Deficits in queer medical knowledge and cultural competency amongst healthcare providers remain primary barriers to queer health access, resulting in many individuals not disclosing their sexual or gender minority status or delaying access to care. We recommend that the government invest funds in and work with all relevant stakeholders to ensure that healthcare providers are adequately trained to provide knowledgeable and culturally competent care to sexual and gender minority individuals across this country. And 4, much of our work involves the correction of existing systems which fail to address our needs. However, with the government's new commitment to move forward on 3 foundational elements of a national pharmacare plan, we have the opportunity to get it right from the beginning. As the government moves forward, it must engage experts in queer health to ensure that our unique needs are addressed, including access to HIV medication for treatment and prevention, HPV immunization, and access to hormone therapy. To conclude, Once again, I'd like to thank the committee for having us. Happy to answer any questions you have, and I will now pass it over to Jeff Shalafu, Harm Reduction Coordinator at the EMHC and co-chair of Edmonton's Two-Spirit Society.
Thanks, Brooke. Tansei, hello. Thank you for this opportunity to discuss the health and wellness of our communities. Specifically, on behalf of the Edmonton Two-Spirit Society and other Two-Spirits across Turtle Island, I wish to thank you. I am co-chair of the and one of the founders of the Edmonton Two-Spirit Society, which is a grassroots organization providing safe spaces and supports for Two-Spirits in the Edmonton area and delivering education to the community at large. I am also a delegate of the International Council of Two-Spirit Societies and a member of the Alberta College of Social Workers Sexual and Gender Diversity Committee as an Indigenous social worker myself. I come here as a storyteller to share about the importance of identity and culture, which will give you some personal insights into how history and current events are affecting Two-Spirits. You have heard a lot already about the disparities faced by the LGBT2Q in the Two-Spirit community, like homelessness, vulnerability, stigma, discrimination, inequalities around access to healthcare, employment, income and social supports, higher rates of mental illness, suicide, HIV, STBBIs, and a plethora of other issues faced specifically by Two-Spirits. And as you're well aware, the overrepresentation of Indigenous communities in terms of other socioeconomic concerns. I could share statistics and research with you around Two-Spirit health as well as the challenges and barriers endured by Two-Spirits, but it would never offer you a true picture. You see, the traditions of Two-Spirits have nearly been eradicated with colonization, residential schools, and the current systems in place for Indigenous peoples. I need not recount that treatment and traumas here, but we can at least honor and recognize that history and what we learned during Truth and Reconciliation Commission. Two-Spirits was once a culture revered and honored that held traditional roles such as medicine keepers, caregivers, and healers. The language and oral history were almost forgotten and some lost forever. In some tribes like the Plains Cree and Blackfoot, there were 7 recognized gender roles, and many tribes across North America understood that it was forbidden to interfere with an individual's expression. Therefore, traditionally, all genders were respected. Europeans didn't understand our culture and actively condemned Two-Spirit people and left us out of history, and further went on to set up systems designed to eradicate the culture. There began a heteronormative cisgendered gender binary. An example was the introduction of gendered spaces in residential schools where children were actively separated according to their genitalia. Most important to discuss today are the impacts for Two-Spirits. To do this, I'm going to share a bit of my own story. I am Two-Spirit, I'm a father, and I'm a social worker. I have lived those disparities you've been hearing of. I've overdosed many times. I've attempted suicide, self-harmed. I live with ADHD, anxiety, disabilities, and endured through things no one need ever face. As a youth in group homes, I went on to live through over 12 years in Canadian correctional systems, and nearly 5 of those in solitary confinement alone. I either lived homeless on the streets of Edmonton or I was in prison. The first needle I put in my arm was with methamphetamines at age 13, at a time when hormones were high and puberty just beginning, where I should have been exploring my sexuality. Instead, I was repressing it. I should have just been a kid at that time, but I wasn't able to because I was lost, confused, and I didn't have the traditional knowledge and teachings. I never knew about my culture because in my family, our Indigenous roots were eradicated. I matured into my Two-Spirit self at 35 years old. This is after nearly 25 years of severe substance abuse. I am now 4 years clean and sober and about to embark on graduate studies in social work. I walk the red road as a traditional Two-Spirit helper. I am also an attuned father to a 5-year-old son who we raised free of the barriers that I faced. My common-law husband and I raise our son with my wife, his mother. We are in each other's homes. We all love and care about each other, and we live freely from shame and guilt. My story is not unique. Time and again, I sit with Indigenous youth to talk about things no one ever talked to me about. Sexuality and sexual health, substance use, and mental health are a huge part of those conversations. One youth said to me when he was 12, he told his foster mom that he had started kissing other boys. So he got a licking, he got grounded, and he got his electronics taken away. Another guy shared that he was kicked out of his house and shunned from the reserve. He moved to Edmonton and soon began doing drugs and survival sex with other men. There are many two-spirits who are lost and simply just trying to exist. You heard from Brooke that I am the Harm Reduction Program Coordinator with EMHC, and I am lucky and honored to make my past experience an asset to those that I help today. I wish